Good morning, good afternoon, good evening, everybody. Welcome to this World Pride 2021 Copenhagen event. We are today focusing on sexual well-being and health. We are the International Planned Parenthood Federation, IPPF, one of the leading sexual health NGOs in the world, providing sexual services, health services in 140 plus countries. With us in this event, we have the main UN organization that provides sexual health services, the UNFPA, the UN Population Fund. And together, we serve communities throughout the world, and we have for a number of years tried to improve our work with the LGBTIQ community. However, we can still see that there are ways we can improve, and we have therefore organized this session where we are bringing some activists to us to challenge us a bit on the work we are doing, how it can be improved, and we hope you'll be enjoying this discussion. We're going to have 3 panels today. The first panel will be the UN panel, if I can call it that, with the UNFPA. There will be Tim Sladden from the UNFPA and their partner organization representative, BC Alimi, who will chat a bit about challenges around sexual health and well-being for sexual and gender diverse persons. The second panel will be an IPPF panel, where we will have discussions on health barriers and how to overcome them, and what should be the principles around our sexual health service provision. And then lastly, we will take advantage of being in Denmark and bring 2 of the host countries, Sweden and Denmark, to the floor, where they can speak about how can a donor country assist in trying to overcome the health barriers that LGBTIQ people meet. So without further ado, let me go to the first panel. In this panel, you will meet Tim Sladden and BC Alimi, who will have a conversation around health, sexual health and well-being for sexual and gender diverse people. And so over to you, BC.
Thank you very much, Tor, for that introduction, and good afternoon, everyone, and good morning. My name is BC Alimi. I am an LGBT activist and an international development expert from Nigeria. I live in London at the moment with my husband and our 2 beautiful dogs, and it's my pleasure to be sharing this moment with Tim. Tim, do you want to introduce yourself?
Yes, thank you, Busy. It's great to join you on this. And I'm Tim Sladden. I work in UNFPA, the Population Fund. I'm an HIV and sexual health advisor in our technical division, and really great to join you today in this quick chat we're going to have.
Tim, I know that you are one of the OGs of UNFPA, and you spent quite a lot of time, almost 14 years with the UNFPA. So I want to ask, do you think the UNFPA is discussing enough, and proactively so, issues around gender identity, sexual orientation, and sexuality? Do you think the UNFPA is doing enough in their programs and also in their literatures?
Yeah, thanks a lot for the question, Busy. I think the honest answer is we need to do more. I think it is an issue that we're starting to talk about, and is really a core part of our mandate, looking at sexual and reproductive health and sexual and reproductive rights in a very sort of comprehensive, holistic way. And the organization, I think it's fair to say, does probably focus more on the reproductive side and ensuring safe motherhood and family planning, and that we have good reproductive outcomes, which is obviously important. But we do also look at sexual diversity and gender identity. Just recently, it's a little thing, but we've included more diverse gender markers in our staff directory so that staff can identify as they and express themselves as they feel and be more themselves and not just tied into the binary male female. So it's a little thing, but it's coming, and I think it's part of a broader push by the UN to be more inclusive, to celebrate diversity and ensure LGBTIQ people are respected and included, both within the organization and in our programming. It's very important that we do more on this. I mean, I think we've come at it particularly from an HIV prevention perspective initially, but that's obviously also important, but we've grown more now to look at the broader human rights of everybody, and where human rights are not respected, where there's violence against sexual minorities, where people can't express their identity or choose their sexual partners and be open about their sexuality. These are the human rights issues that are fundamental to what we need to work on and support. And I'm really delighted that our executive director, Dr. Natalia Kanem, is giving some opening remarks to Pride 2021, and that's great. It shows really the high level support that we give to diverse communities in the LGBTI community. So I'm really glad that Natalia has found the opportunity to make some opening remarks to Pride. But I mean, we know that really the UN can only be a sort of facilitating or brokering role, and you are coming from the community perspective, and this is where the real the hard work and also the progress is made. So it would be great to hear what you feel enables you to be an activist, but also to increase LGBTI people's acceptance and place in society. I mean, it's all about being part of society, really, isn't it?
Yes, it is. It is. And a team is not just being part of the society, it's also being able to contribute to the society, because being part of the society can sometimes be limiting in of itself. But having the opportunity to also proactively contribute and have a voice and have a presence and be visible within the community, within the society, it's also very important. And I remember when I started off, I always tell people all I wanted to be was an actor and not an activist. I went to drama school, I wanted to act. But and this was in early 2000, I lost my best friend to AIDS when we were still in the university. And that was one of the few turning points in my life that put me in a position to ask fundamental questions. And, these were times that, even the UN, the UNAIDS and all of these organizations were just coming up. They were just trying to open up the conversation around, sexual orientation. And we're not even talking about sexual orientation, we're talking about sexual behavior, because it was behavioral communication techniques that we were using. So we were still a little bit in denial of the fact that, okay, there is something about sexuality and sexual orientation that we need to be talking about. But we were very focused on, just use condom. And it goes beyond using condom. As I grow older, I realized that, yes, you can tell me to use condom, but you have to tell me why using condom is beneficial to me as a gay man, because you cannot just drop condom and lubricant and say, go use it. I want to understand why I'm using it and what I'm using it for. And this kind of information will kind of help me to be in control of my own health. But not just that, to be able to have informed conversations with people in my community who otherwise do not have the same privilege that I had. And I remember I was one of the very few young people who were very, very active in youth advocacy in Nigeria. And then went on, to find my voice. I came out on national television, but I was very, very committed to community engagement because that's where the power is. And we can look back now to UN agencies that we have. They didn't get to where they are today, right? They got there because community organizing, whether it's from New York to London, from Johannesburg to Lagos, from a rural town in Rwanda to Congo. These were people, there were communities that were coming up and they were demanding not just for access to treatment and prevention, but access to the dignity of a person, to be recognized, to be at the table, to have a voice. And this community organizing has helped organizations like UNFPA to be conscious about the language that they are using, to be conscious about the programs that they are delivering, to be conscious about everything that they are doing. And I find that, there is a collaboration between the community and also policy and implementing organizations like UNFPA and UNAIDS agencies like the World Bank, the IMF, and the rest like that.
Yes, it's very interesting what you're saying. I think looking at sexuality in a more holistic way, I mean, it's certainly not just about providing a condom. We're all sexual beings and have sexual and reproductive health needs. And how can we meet those needs? So I think a lot of what we're trying to do is to provide comprehensive sexuality education for young people who are before they become sexually active, so they're making informed and responsible decisions, and also people maybe starting to identify their sexuality and their identity, and so giving people, young people, a safe space to really grow into themselves and be themselves is really important, and then later on for their sexual and reproductive health needs to be met. So it's very interesting what you're saying about just to be able to be, and not to be an activist, but to be part of society and to contribute. And I think that's, UNFPA really is about this, about celebrating diversity, ensuring an inclusive society, that everybody is respected, everybody is able to express themselves. And yeah, you're absolutely right. The community has led this, always leads these development processes, and we're sort of trying to help. I think we can do what we can to broker and to sort of support, but it's the community empowerment is essential as the primary element for this. So yes, I really congratulate you and all in Pride for your participation, and that we can see an actual Pride event like this now is accepted in the broader society. That's wonderful, really. It shows, where things are changing and there is an increasing acceptance. But I think there's still a long way to go. What are some of the challenges, do you think, that are still to go? Still we face?
I think one of the biggest challenge is still the access to events like this, right? And we can look at this as part of the few lessons that COVID has taught us about the fact that we can go virtual. Events can happen virtual, and people around the world can be part of it, even in their own safe spaces. And I think that opening up this kind of activities is great. But I also think that fundamentally having organizations like UNFPA, like UNAIDS, like UN Women, being part of organizations like this, send a very strong message, not just to the communities that are deprived of access to these things, but to government agencies around the world, that UN as an institution will not sit on the fence anymore. That UN as an institution strongly believe in the fundamental human rights of everyone, and the UN as an institution will stand for justice and for rights. And I think this is a very strong message to send out, even more so at this time that we have COVID, where the LGBTQI community, where the sex workers community, where the trans community are driven into the background, and not, their struggles are not even highlighted anymore. There is no better time to make such a very strong, powerful commitment, whether in action or in statement, than now.
Yeah, right.
So, yeah.
Thank you. Yes. Well, we will continue. We're very pleased and glad to be an ally of the LGBTI communities. And as I say, we need to do more in terms of advocacy and bringing community and government and other parts of society together to really ensure that everybody is welcomed and we have inclusive societies. So, yeah, thank you so much, Busy, for chatting. It's been really very useful and interesting, and I wish you all well in this Pride Month. Yes.
Thank you so much, Tim. I have really enjoyed talking to you, and I've learned a lot from you as well. And to everyone that is watching, thank you so much for watching. But also don't forget that Pride does not start and end in June. For LGBTQ people all over the world, Pride is every day. And there is no template for how you can celebrate your Pride. So celebrate it the way you feel like. Be you, be real, and be fabulous. Thank you very much for watching. And now I pass it over to you, Tor.
Thank you, Busy. Thank you, Tim. That was a great way of ending the session, and with the challenge to all of us that not just here in World Pride, but all through the year, we should be concerned about LGBTIQ rights for everybody. It was also great to hear a representative from the UN speak the way you did, Tim, about how we are still having a lot of challenges, but that there are some things, some small, some bigger, that have been changed and improved during these last few years. And it is great that the Executive Director of UNFPA is here to open the event, showing that the UN is on its way to be a great ally for all of us queer people. So over to the second panel today, which is an IPPF panel, where the chair of our board will speak about our commitments to LGBTIQ people. And she's being challenged by one of our activists, Nish McLean. I'll leave them to introduce themselves more. Over to you, Nish.
Thank you, Tor, for the brief intro. It's a pleasure to have this important conversation with you, Kate. I'm really looking forward to co-creating this space with you as we talk about equal rights and access to healthcare for LGBTIQ people. But first, let me introduce myself and then hand over to you, Kate, for your own introductions before we get into things. So my name is Nish McLean. My pronouns are he, him, they, them. I'm based in Kingston, Jamaica, and I'm a transmasculine person, queer, and I am also the chair for the Nominations and Governance Committee here at the International Planned Parenthood Federation. So that's pretty much, in a nutshell, who I am. So thank you so much for having this conversation with me, Kate. Over to you for your own introduction.
Thank you so much, Nish. I'm here because I'm the chair of the International Planned Parenthood Federation Board of Trustees, and it's really that identity that I'm wearing most strongly today. I was with the UN for a number of years working on human rights, and I have an association with Harvard School, the Harvard Kennedy School, working on human rights policy, and it's a great joy to be here.
Awesome, Kate. It's always so great to work with you. So I'm so happy that we are both having this conversation in our roles at IPPF. And so now that, people know who we are, I thought we could just jump right into our conversation. And so I just have a first question for you, Kate. If you could let us know, what your thoughts are about how do we overcome norms and stigmatization that leads to violence and discrimination against LGBTIQ people.
Thank you, dear Nish, and for all that you do for IPPF, which is truly remarkable. For me, I think we've three main things we must do as an international community, but with local results. We must defend and protect, declare and denounce. We must campaign and challenge. And by this, I mean defend, protect not only our rights to live and love without fear or threat, but our rights to enjoy, to celebrate our intimacy, our pleasure and our love. And that does mean we must work for guarantee of ease of access to high quality, affordable assets of support, information, guidance, services, education, those things that we all need to ensure dignity in intimacy is always within our reach. But we must also document, declare and denounce the violence to which LGBTQI persons are subjected. We must ensure that we're not joined to the silence, the denial, the complicity. Instead, we must gather and promulgate the evidence that shows so clearly the cost, the cruel cost of the casualty of violence directed at LGBTQI persons, the casualty that is abuse of mental and physical integrity on the basis of gender identity, of sexual orientation, the criminalization of consensual love. And for that, I think we have to campaign and challenge to demand change. That, for me, means mobilizing communities of solidarity with LGBTQI persons. It means a broad-based invitation to action so that we work to shift these toxic social norms, to stand up clearly, to challenge the stigma, bigotry and hate that plagues the daily lives of LGBTI and Q people the world over. Human beings, after all, invented hate. We can end it. We can end the political, the social, the culturally constructed, perverse stratification of human beings into these dehumanizing rankings. Your gender, my age, their disability, the color of your skin, the sound of my language, how they worship, whom we all love. These multiple forms of discrimination are intertwining to bind the feet, to gag the mouths, to stifle the joy, to waste the talent of millions of people the world over, in conflict settings and in peacetime, in the context of migration and in our own homes, when working for decent pay or labouring without just remuneration, in sex work, in domestic work, in volunteer work. In all those settings, the bigotries of homophobia, transphobia, xenophobia, they're not only repugnant, they are weapons, they're killers, human-made assaults on humanity itself. And for me, the implications today of that hate for love are more grave than ever before, because onwards through puberty and into full adulthood, the world's largest generation ever of young people are today journeying a human journey that we all took of becoming who we are, of becoming identity, of intimacy, of pleasure. And yet 90% of today's young people, that largest generation, are located in places where enjoyment of sexual and reproductive health and rights are at their most obstructed. How can we tolerate for even 1 minute more those norms, those practices, those laws, those policies that make of our intimate and sexual selves, of our innate and diverse, even shifting gendered and sexual identities, that make of them a basis for hate, an excuse for violence, a cause for self-loathing, a reason for exclusion, a crime? How can it be that we're so quick to outlaw love and so slow to end hate? Look, you don't have to be like me to respect my rights. I don't have to be like you to uphold your rights. We don't have to approve of each other to defend each other's rights. Rights aren't a beauty parade. They're not a reward system. They're not some kind of nepotistic prize for good conduct. Rights are simply those things that can't be taken from us. Rights are for the best of us, for the worst of us, for each and every one of us, to the exclusion of none of us, in the interests of all of us, and against attack, we all must be defended. Nish, given the urgency of that project of standing up for our rights to love, where can we find progress? How can we work together for equal rights and for access to healthcare for all?
Well, Kate, that was really lovely to listen to, and thank you so much for the work that you are doing and for articulating such a nuanced perspective and passionate, like just information about what's so critical and what's so important about the freedom to love consensually and where we are as a human race, right? And protecting each other, valuing each other, and celebrating our diversity, which is exactly where progress lies. That is the beginning of how we can have progress, because, I think part of it is the conversation around inclusion and the needs that LGBTQ people have in how policies and the language that we use should really support, uplift, and celebrate, LGBTQ people's diversity. And I think when we look at it too, when we're talking about access to healthcare, we have to look at the most vulnerable and marginalized communities. And one of those conversations, even for the IPPF, is around period poverty, right? And there has to be a nuanced conversation around period poverty. And I'm happy to see that happening now as a part of that progress when we talk about the policies and words that we use that shift to talk about people with periods, including trans men into that conversation. I see that happening globally, and it's very good to see. It's a very important framing that we must have. And likewise, when we talk about access to abortion, the needs of lesbian and bisexual women, as well as trans folks, including non-binary people, have to be represented in those conversations. It is a must. We cannot talk only about issues impacting some people without including how issues impact other people. It's very central. And if we're also talking about intersectionality, which you also mentioned before, I think we have to recognize as well that the most vulnerable and marginalized communities are at the forefront of social change. People like me, our lives depend on these conversations to include us. And I see that in the Caribbean, I see it around the globe as I connect with my peers. And what's important for us to also share as queer people is that we're no longer asking for a seat at the table. We're building our own tables, and we're thinking expansively about and abundantly as well about what it means to live in a world that sees the humanity in all of us. Equal rights and access to healthcare as a particular issue is a human rights issue, right? And importantly, we must also understand that our struggles are connected. They are intersectional. And I have to quote Audre Lorde here, right? Because she says that there's no thing as a single issue struggle because we do not live single issue lives. So working together for me means that we must understand that inequality that exists, it is because of patriarchy, it's because of heterosexism, it's because of racism, ableism, and capitalism. So we have to continue to break down these barriers and these systems of oppression that really impact the most vulnerable and marginalized of our communities, and that intersection with gender justice, with climate change and climate justice, and so all of our communities that are impacted most significantly have the capacity, the tools, and the skill set to continue to collaborate and to work across borders, across regions, to really see the change that we want to see, particularly as we celebrate Pride, and in a month like June, Pride Month is so significant for us as a community. And so we're very thankful that we can have these conversations and really see where we can go as communities with our allies to celebrate and to champion change. So, I just really wanted to really connect those points as so important and to really echo some of what you have said, because it's you couldn't have said it any better, Kate. So I'm just really thankful that we could have this space to have this conversation with you. So thank you so much.
Thank you.
Yeah, so with that being said, I think we can close here. So thank you so much, Kate. It's been such an immense pleasure. And I just want to really say how much the work of the IPPF means to both of us and what we have been able to do together collectively. So that's us for today. So thank you, Tor. Back over to you.
Thank you very much to Nish and Kate for that inspiring talk. I really like the way we challenge ourselves and to stop the hateful love. And how can we think about another way not to be so quick to outlaw love and so slow to end hate. Access to healthcare is a human rights issue, and that's where we have to move towards. So for our last panel today, we are moving to the hosts of this World Pride, which is jointly by Sweden and Denmark. And I will give the floor to my colleague in IPPF Denmark, Preeti Sundaram, who is going to interview a representative from the government of Sweden, or from SIDA, Mikaela Hildebrand. So over to you, Preeti.
Great, and thank you for the introduction, Tor. I'm really excited to have a conversation today, which will be around how policies, laws, and implementation can promote safe and healthy services for LGBTI communities. My name is Preeti Sundaram. I'm a Senior Global Policy Advisor at the Danish Family Planning Association, otherwise known as Sex Samfund. And I work primarily on global multilateral spaces and trying to advance sexual and reproductive health and rights and LGBTI rights for all. I'm joined here by Mikaela, and I'm wondering, Mikaela, if you'd also like to introduce yourself.
Yeah, hi everyone. My name is Mikaela Hildebrand. I'm the Deputy Head of Sweden's regional team for sexual and reproductive health and rights, based at the Swedish Embassy in Zambia, in Lusaka. And where we work towards advancing SRHR through regional contributions.
And amazing that we could be joined across the distances as well. So I think let's just jump straight into our conversation today. I think the first question that I'd like to ask you, Mikaela, is how can SIDA use their voice in terms of LGBTI people in regional and national conversations? And what do you see as the most central mechanisms to look towards?
It's been so interesting. So SIDA over the past 15 years has gone from almost no support to LGBTI to about 20 million US a year in funding. And we moved very much from a sort of health HIV lens to a much stronger human rights democracy lens, which I think is really positive. SIDA takes a multi-dimensional poverty analysis approach to how we program. And so for us, this is really an issue about lack of power, lack of voice, lack of security, opportunities and choice, and also, of course, with respect to material resources. So for us, this is really the centrality of this as a human rights issue for us is just at the core. I think that's also very much compounded by the Swedish feminist foreign policy. And through that policy, we've been developing country briefs on human rights, LGBTI persons, a tool for engaging in dialogue around this issue, which of course, sometimes can be as a funder, sort of northern-based funder, not completely self-evident exactly how you would position yourself and how you would engage. So as someone who works at the regional level, what we see ourselves, of course, as a funder foremost, but also as an actor in our own right. And from that perspective, there are a couple of different things that we do. When it comes to the funding from a regional lens, of course, this means working with and strengthening capacity of institutions to work on LGBTI rights. And that means working with regional constellations of judges forums or regional constellations of parliamentarians, both directly through direct funding, research organizations, but also through UN partners and building that technical capacity, as well as sort of direct support to LGBTI networks to ensure they have the preconditions and the capacity to engage as actors and activists. But that's the funding envelope, and of course, there's always going to be a component of that is about donor coordination, ensuring complementary funding strategies, and also dialogue with our partners around good practices of how to fund LGBTI communities and movements and organizations in the best possible way. And that, I think, is an important part, what we have to engage in as a funder. But then we also, of course, leverage our own sort of convening role as a SIDA, both through creating sort of safe spaces where we can, to provide platforms and arenas for different types of actors to meet who maybe wouldn't otherwise meet. We've had instances where we opened up our embassy to ensure meetings between members of parliament and activists, take them outside a sort of normal engagement, and create opportunities for dialogue, for understanding between different types of actors. And we believe that that type of matchmaking or that type of convening to create these opportunities for actors that wouldn't otherwise have met is really something that can drive and spur activity and action moving forward. Another way that we engage, of course, when there's an emergency situation. Here, often where we have the capacity, we will engage in coordination amongst key actors. We'll of course also engage through what's called silent diplomacy, or sort of behind the scenes diplomacy and engagement. And for us here, it's always critical to have our ear to the ground and then really take our cue from local organizations, understand their analysis, the risk that they're exposed to, and get their advice of how we can be most helpful, constructive, and how we can engage, of course, from a perspective of doing no harm, which is always a risk in these emergency situations, but also to help unlock where we can situations. And this is something which we do engage in as well. So those are some of the ways in which we, I think, both as a regional funder, but as a bilateral funder, we engage. So over to you. I think we do work a lot with civil society, both of course northern-based civil society and civil society in the region. And I'd love to hear your reflections on what you think is the role of civil society in ensuring accountability and implementation of global and regional agreements on LGBTI rights to ensure access to services. And sort of some of those political dynamics, I think, that are in play in terms of different types of organizations working in these spaces. I think as a funder, we always try and negotiate and navigate those dynamics as well. So it's always interesting to hear.
Yeah, thank you for that question, Michaela. And I think you've also touched upon some really interesting points around how we need to use different strategies to really affect change. And actually, there are different tactics we need to use. And I think on the point of civil society, I mean, I think here at the Danish Family Planning Association, we work on many different levels to affect global standards on human rights, but also at the regional level and also at the national level. And I would say that one interesting observation I've had actually working in these spaces under or during the COVID-19 pandemic has really been around the restrictions that civil society overall have had in terms of engaging in these quite important influential spaces. At the global level, we see restricted access to multilateral spaces, but I think you'll be very aware that there are a lot of national examples too, where we see human rights defenders and LGBTI activists who are being, where there are raids taking place and where we see that their rights are really being violated. So I think that the COVID pandemic has really affected the space that civil society has to mobilize and to activate. But with that said, I think we play a crucial role in terms of affecting change at different levels. So at the global level, there's the human rights standards. At the regional level, you've touched upon some of those dynamics as well. And I think that we play a role not only in terms of working in partnership with our governments and in trying to affect change, but also in the accountability work. So holding governments to account and making sure that we also have that watchdog role, so we can make sure that governments are keeping their promises. I think it's a really interesting point you raise around the different geopolitical dynamics, and I actually really enjoyed listening to what you said around the donor kind of configurations of all those political dynamics as well. For organizations that are northern based, like the Danish Family Planning Association, I think our ambition and the kind of the approach that we take is very much to try and create equal, reciprocal, sustainable partnerships with civil society organizations, including in the global south. But I think that you touch upon some really interesting points around what happens in reality and what happens in practice in terms of, especially on this agenda, which can have some really quite strong national limitations and some national contexts. I think the most important voices that we can be guided by are the national voices that know their context and they know what's possible in terms of advocacy change and how to kind of mobilize and activate within those spaces. So I think in very much keeping with your principle of do no harm, that is something that we very much try to live by. But I think it's important to acknowledge the structural challenges and the power dynamics that are at play between the different types of civil society organizations that are operating in that space. I'd say that our ambition as well is to amplify voices rather than take up space. And I think that's an important approach as well in trying to create platforms for different groups to access decision makers. I don't know if that answers some of what your question was. But I suppose I'd also be really interested, just on that note of kind of including stakeholders and talking to different groups, I'd be really interested to hear how CEDA and you work to kind of include all relevant regional stakeholders to improve health services for LGBTI communities, and how we can include stakeholders in these processes and in these conversations.
Yeah, no, I that's really helpful. I mean, I think it's something that we are constantly thinking about, and you know, for CEDA, I think inclusion, transparency. I mean, these are values and principles that we really live by in our everyday decision making and everyday operations, and so it's something that you know, that type of creating processes or creating platforms that enable that type of participation is really at the heart and center of how we do work. And it's not always easy, particularly in grant management. You know, these processes are not always sort of set up to enable that type of participation. And I think, you know, we've had a really interesting example, particularly in the LGBTI space, where, you know, we had been funding a number of different organizations over a period of time, and we felt that we weren't, for a variety of different reasons, moving forward in a way that was really enabling that type of long-term change. And we did a sort of first assessment of understanding what are some of the challenges here, particularly, again, looking from a funder's perspective. You know, what are the practices that we can adopt that enable that type of longer-term strategic planning? And I don't think I need to tell this community how underfunded the LGBTI space is. You know, how much funding is short-term, how much funding is project-based, that doesn't enable for that sort of institutional capacity development, which is a real challenge in the sector. And so what we did is that we sort of took a slightly different approach to how we would normally do grant making within CEDA. And we put in place a process where we basically we spoke to a whole range of different actors and said, you know, who is a legitimate and critical partner who's able to convene actors in this space to start looking at advancing some of these questions, particularly looking at from a regional perspective, countries where we think that there's real opportunity for change over the next few years. And interestingly, a number of actors came back and said, well, you know, if we do want to create, sort of really focus our work on coalition building and alliance building, you know, we do need to have a partner that is able to convene and bring together both government and civil society, that we can't have an approach that is only looking at civil society as the main entry point. And so we ended up working with UNDP in this constellation, but really being very clear with UNDP that it's not about UNDP setting the agenda for this program. What we want to do is put together a process that engages a whole range of different actors, both from civil society, activists, the whole sort of diversity within the LGBTI space, of actors, but also bring in parliamentarians, bring in the regional economic communities, bring in the researchers, and draw on all of that experience and understand sort of what are the different perspectives, different priorities that are, you know, and where are the common agendas, so that we can identify those common interests to advance together. What we then did was the group that worked together was that developed sort of a 10-year theory of change, recognizing that, of course, as CEDA, we can't make a funding commitment for 10 years. But what we can do is we can say, we want you to plan for 10 years, because we recognize that the type of changes that we need to you know, drive legislative change, to drive policy change, to enable services to be available, these things are, you know, we have to be in it for the long haul. And so we can say, we can allow for planning on a 10-year horizon, and then say we can commit funding over a 4-year horizon, recognizing that, of course, there is a risk. If the program fails to deliver results, it's not possible for us to continue funding. But at the same time, and of course, the sustainability of results outside of CEDA-specific funding. But if we allow, at least in this instance, for that type of longer-term strategic planning, you know, could we come up with something that's slightly different? And so we did that. And even though it was a risk, I think it was a calculated risk that we took. And it's been really interesting to see this program come together. It's called the Inclusive Governance Initiative. And the UNDP specific component looks at the sort of, it's a 4-year program that looks at a separate set of interventions, looking at that nexus or interaction between governance, democracy, and LGBTI rights. but very much focusing on building coalition, expanding the constituency that are pushing for LGBTI rights, ensuring that there's broad-based alliances built at the country level around this type of change. And then that program specifically is being positioned in a much bigger theory of change that looks at 6 different strategic pathways, that looks at laws, inclusive governance, looks at social norms, looks at social movements, public sector services, knowledge, data, evidence, politics, practices, so that the specific contribution can position itself in a much bigger picture and as one of many actors that need to be pulling together in the same direction to achieve that sustainable change over a long time. So it's been a really interesting process. I think for us to have sort of a very participatory priority setting for a UN agency, at least at the regional team, was very much a first. And so we're quite excited to see how this ends.
Your ambitions are huge, and I think that's the way to go. And I think it's so impressive that CEDA is thinking 10 years down the line as opposed to 1 or 2 years, because we know, especially for smaller LGBTI SRHR organizations, funding and sustainability is key to how much they're actually able to achieve in terms of policy and political and social norm change. But I think what you're describing for me sounds like almost a redistribution of power longer term as well, because what we're talking about is resourcing communities to take to have that ownership and to have the ability to kind of navigate in spaces that are sustainably funded and sustainably supported as well. So I really, really feel quite excited by that model you've just described. And I think it also potentially gives a lot of space for donor coordination around longer term plans, especially on areas like advancing LGBTI rights. So thank you for sharing that, Michaela. And I'm aware that we're out of time and this conversation could carry on for much longer. But I just want to say thank you for sharing your work and CEDA's work. And then I think I'll pass back over to Tor. So thank you so much.